Hello and welcome. I'm Sophia Cruz, and today you're with us for another episode of Rappler Recap. Kasama ko ngayon si Bons Magsambol, Health and Education Reporter ng Rappler. Ako naman din yung reporter for the pandemic along with Bons. 2 years na since na-implement yung first ECQ sa Metro Manila tapos lumawak ito sa buong Luzon. At looking back, no, akala natin na 2 weeks lang yung first ECQ na yon. Pero magto 2 years na at dito pa rin tayo sa pandemya. So ngayong araw mag-recap natin yung mga biggest changes that have taken place under the pandemic. And um, Bonds and I are looking back at this moment because we're also at a crossroads where nasa gitna pa tayo ng pandemya. Pero of course, we're looking at ushering in a new normal. Some areas in the Philippines have already entered that, but really, this is all moving towards a situation that many officials and experts have talked about for a long time, which is really living with COVID-19. But before we get there, um, it's good to look back at some of the biggest changes that have taken place. So siguro, set up ko muna kung ano yung lay of the land right now. Ano ba yung situation uh, dito sa Pilipinas regarding COVID-19. So, kagaya ng sinabi ko kanina, yung Duterte government, they're very much pressed to usher in a new normal and really jumpstart the road to recovery. Um, After 2 years of different iterations of lockdowns in different severity. So, nakikita natin to sa iba't ibang activities like vaccinations are in full swing, students have started slowly returning to schools, yung mga restaurants, cinema, stores, open na sila for business, which we'll all talk about in detail later. Pero importante ring i-highlight na millions of Filipinos appear also to be ready to kind of move beyond the pandemic. And we see that, for example, sa mga public surveys recently where 51% of Filipinos, ayon sa social weather stations, reported na 51% of Filipinos expect the health crisis to end within this year, 2022. Although around 45 think that it would still extend beyond this year. Pero optimistic naman din yung mga Pilipino kasi mga 45% of adult Filipinos were saying that they believe that their lives would improve in this next year. So, um, like I mentioned earlier, yung isang pinakamalaking change that has taken place from the 2 years from 2020, early March 2020, when we were just going under the first Luzon-wide ECQ, which became one of the longest lockdowns in the world now, is we are now a lot of parts of the Philippines, Metro Manila, and 47 other areas just recently are now under alert level 1. So, yung alert level 1 ay yung tinatawag na new normal ng government. Here, wala nang restriction. So, if in the first year of the pandemic, in the first ECQ, you could only go out for essential activities, and restaurants, many establishments were closed down. Now any area that's under alert level 1 is practically fully open. um, and we got here by meeting certain targets set by the government, no. Firstly, na yung mga risks for the cases are low to minimal, at least 70% of the total, oh sorry, not the total, of the target population of a certain area is fully vaccinated, and at least 80% of the 85% of seniors in a certain area are fully vaccinated as well. Um, just looking back a bit, the ECQ was implemented 4 times, if you all remember. At at each of these points, usually driven yung implementation ng ECQ by a new variant. So there was the alpha and then the delta, kung naalala mo, diba, Bonds? Alpha,
Oo,
delta, Omicron, and might be forgetting
beta,
another.
beta.
Beta. Yes,
Yeah.
yes. Thank you for mentioning that. Yeah. Um, but I think, and so all in all, these near standstills cost the government, cost the Philippines around 3.8 trillion pesos in losses by 2022, no? But more than the economic, aside from the economic losses that the country has experienced, um, the another really big change that happened over the last 2 years was that there were more deaths than normal. So, right now, yung tally ng COVID-19, yung official death toll of COVID-19 is around 57,000, over 57,000 Filipinos who have lost their lives from COVID-19. At nakita natin na over the past years na yung severity of COVID-19 has really varied based on many factors. Kung may underlying conditions ka, ano yung vaccination status mo, pero at age din. And really, out of all these groups, it's really the elderly, senior citizens who have borne the highest risks from COVID-19. Kasi sa sa lahat ng mga deaths, 70% nag-occur sa mga elderly population. And there have been more deaths than normal in the last 2 years kasi na-track ng PSA yung what they term as excess deaths, which is
Okay.
the number of deaths that the excess number of deaths that occur in a certain period of time compared to, let's say, this time compared to 5 years before the pandemic. At nakita nila na there were 450,000 more deaths in 2021 than normal than the same time 5 years ago. So just to kind of picture or visualize gaano kalaki yung mga loss of lives na nakita natin sa pandemya over the last 2 years. If you think about another disease, let's say influenza, usually nagko-contribute yung influenza to around an average of 5,000 deaths per year.
Mm.
And by comparison, in the last 2 years alone, over 57,000 people have died from COVID-19. Pero hindi lang yung but I think another really big change is the schools, which Bonds can talk more about.
Okay, yeah, thank you, Sophia. So yeah, I've been covering the education crisis nga din during the pandemic, and then when the lockdown was declared or was imposed in March 2020, schools were the first ones to close. 'Di ba? So since then, we've been using distance learning system. So itong distance learning system na to parang hindi to tinanggap ng marami kasi sinasabi nila na hindi prepared yung country natin with the digital shift, given na wala tayo gaanong resources. Pero ayun, paulit-ulit na sinasabi ng Department of Education at ng gobyerno na despite na may pandemic, kailangan mag-continue pa rin yung education. So yun nga, since 2020, yung mga estudyante, dalawang graduation na yung hindi sila nakapag-march, important milestone on their lives na hindi nila nagawa yon. So slowly ngayon, actually ngayon, the Department of Education is eyeing to do limited graduation na. So sana if the pandemic situation continues to improve, sinasabi nila na baka nga payagan na nila. So yeah, since the pandemic, so since tayo yung una tayo yung nag-close, yung mga schools yung mga unang nag-close natin, tayo din yung pinakahuli na nagbukas ng mga schools for limited face-to-face classes. So imagine, sa buong mundo, tayo yung pinakahuli. And then hindi din siya lahat ng schools. So meron tayong 60,000 na schools sa buong bansa, public and private. Pero meron sa ngayon as of March 10, I think that's the latest data available. 6,122 pa lang yung nagbubukas, and that's on a limited basis. So ibig sabihin noon sa isang classroom, 15 to 20 students lang, tapos yung mga subjects nila sobrang unti lang ng tinuturo kasi yung iba, yung mga estudyante na hindi uma-attend doon, yung half noon for example, continue sila ng modular learning. So yun, itong pandemic it highlighted the cracks in the Philippine education system na sinasabi na din ng mga experts na matagal na meron pero mas na-aggravate ng pandemic. Like for example, before kung yung problema natin is yung lack of textbooks, lack of like for example, lack of chairs, 'di ba? Yung mga chairs sa mga public school, lack of classrooms, lack of teachers. Ngayon, walang internet connection yung mga bata. So marami talagang batang naiiwan. So ito, wala pang nagagawang large scale assessment kung gaano yung impact nitong education crisis na to during the pandemic. Pero paunti-unti yung mga small scale or yung mga surveys na lumalabas, sinasabi nila na parang yung mga students hindi natuto dun sa 2 years nila naka-distance learning. So, imagine kung gaanong catching up yung gagawin ng mga teachers natin once all schools will be allowed to do face-to-face classes na. And then aside from that, ayun nga, with the of course, yung vaccination ng mga bata, ayun, kaugnayan dito sa face-to-face classes. So, sinasabi ng Department of Education na hindi naman required para sa mga bata na gustong mag face-to-face classes yung vaccination. Pero sa mga teachers, required sila. Ayun, and then sa college level naman, ayun nga sinabi ng Commission on Higher Education the other week that full capacity na yung mga classrooms. Pero kahit na full capacity ito, kailangan pa rin yung mga classrooms natin, yung mga facilities natin ay i-check siya ng CHED kung angkop ba ito or sa paggagawin na limited face-to-face classes. Like for example then, hindi na pamula freshman students hanggang senior. So uunahin nila yung mga estudyante na may laboratory courses or yung mga estudyante na may higher courses and graduating. Ayun. So
Pero
ayun, so far yun yung ano
Pero
natin sa education
may
sector.
tatanong lang,
Yeah.
yeah, may tatanong lang ako kasi I remember you
Okay.
also spoke to a lot of students over the last 2 years. Kamusta naman sila? Kasi 'di ba, of course, may
Mm,
yung academic side,
mm,
schools may academic side, may academic aspect, pero merong ring social aspect to
mm,
school, 'di ba? Kamusta naman sila sa social aspect at sa
mm,
um yeah, like making friends and everything?
mm. So tama ka diyan, Sofia, mabuti na natanong mo 'yan. Nung nagpunta nga yung Rappler sa Pangasinan, last November 15, I think, yeah. So last November 15 kasi yung Pangasinan yung isa sa mga schools na nagbukas for face-to-face classes. So we talked to a lot of students there, to a lot of parents, and sinabi nga nila na parang itong mga estudyante natutuwang-tuwa nung malaman nila yung news na kasama yung paaralan, yung school nila sa gagawin na face-to-face classes. Yung isang estudyante na nakausap natin, sinabi niya na parang finally mamimit niya yung mga classmates niya. Kasi imagine, parang nung nagsara yung class, I mean, nung nag-close yung school, parang first time niyang mamimit ngayon, ngayong nung nag-start nga nung January 15, nung November 15. So yun, ganun. And then kahit kasi yung mga parents kasi yung problem dito sa distance learning, it goes beyond yung access talaga sa digital technology. Kasi yung mga estudyante na walang magulang na not capable of teaching them at home, doon nagkakaroon ng problema kasi walang naiiwan sa kanila to guide them doing their modules. So yun talaga yung problema. And then yeah, sinalubong ito ng magandang balita. I mean, magandang balita ito para sa mga magulang talaga kasi ngayon nga na slowly nagbubukas na yung economy natin and actually full na, 'di ba? Yung new normal. So bumabalik na din talaga sila sa mga trabaho nila and walang maiiwan. So it's a good news for them na babalik na yung mga estudyante sa school.
Siguro isang malaking change din or rather not a change, pero isang,
Mm.
malaking aspeto rin ng pandemya ngayon ay sa Pilipinas nagma-mask pa rin yung mga tao. Can
Yeah.
you tell yeah, maybe you can tell us
Okay.
more about it? Mhm.
Okay, sige. Yeah, important to note din 'yun kasi parang ngayon 'di ba dahil nga cases are on the decline, so patuloy siyang bumababa. So I think for the past 2 weeks, more than 1 week na since since we were placed on alert level 1 yung Metro Manila and 39 other areas, ano na tawag do'n, may mga meron ng mga discussions if kailangan ba talagang naka-mask pa rin tayo, 'di ba? So yun nga, so yung mga experts natin sinasabi nila na yung face mask should be the last, ito yung last na protection na kailangan nating tanggalin kasi regardless kung alam mo yun, kung mababa yung kaso pero ito yung parang protection na meron tayo ngayon, 'di ba, na as in parang sabi nga nila it could spell life and death, 'di ba? Yun yung sinasabi nila. Ayun, and then of course sinabi ng Department of Health din na parang if nga magda-downgrade pa tayo to further, ayun nga may pino-float silang term ngayon, alert level 0. Pero sinabi ng Department of Health earlier na parang hindi pa final yung term na alert level 0 kasi ayaw nilang banggitin na 0 kasi baka it might confuse people na baka isipin nila na wala ng threat ng COVID. So ayun,
mm,
pinag-uusapan nila yon, pero yung pauna na silang nagsabi na parang yung face mask hindi pa rin nila ito tatanggalin. Ayun.
mm, mm. I think importante ring i-point out na um of course the health officials and some experts aren't looking naman at the scenario kung saan na magmamask tayo forever. Pero kailangan muna i-meet ilang mga targets. So, I think
Mm.
isang pinaka-importanting target na naka-relate dito is yung vaccination targets, 'di ba?
Vaccination.
So, kung naalala mo nung 2020, yung first target ng hindi lang ng Pilipinas pero ng iba't ibang bansa ay 70% ng mga populations
Mm.
kailangan, fully vaccinated. Pero dahil nga may mga variants ngayon ta's, um, may iba't ibang mga variants tapos nakita din ng mga scientists na hindi masyado effective yung, vaccines that are currently available against preventing infection, but very effective
Mm.
still against preventing severe infection and hospitalizations and deaths. Pero because it's not so good at preventing infection, then the idea na kaya pa ring mag-attain ng herd immunity
Mm.
has kind of faded, has kind of that's gone out the door. And that but that's not always a bad thing. What that just means now is kailangan na mas mataas na yung target. So
Yeah.
instead of 70%, ngayon kailangan ng mga 90% of the population is fully vaccinated.
Right.
Pero actually may mga iba't ibang experts na sinasabi rin na mas magiging kampante sila kung 95% of the population um would be fully vaccinated. 95% is pretty much
Okay.
everybody who is 6 months and older. So only babies who are 6 months and younger wouldn't be vaccinated because they wouldn't be eligible yet. But then the reason why they're saying mas kampante sila sa 95% or even yeah, at least 90 to 95% is because of that. If you want to be able to, kung yung goal talaga ng vaccinations is to prevent
Mm.
death, then we need to be able to vaccinate every single person who can be vaccinated. Hindi na nagwo-work yung idea ng yeah, herd immunity or like population protection because yun nga of the waning immunity that happens over time because the vaccines aren't very good at preventing infection, but vaccines itself still continue to save lives. That's why everybody who can get
Okay.
vaccinated should. Pero just to lay out din, no? So, habang 2 years na tayo since yung first ECQ, it's also been a year since the vaccine drive started. And at this
Yeah.
point, 60% or so of of all Filipinos have been vaccinated with 2 doses. So pinaka-effective strategy pa rin yung vaccination. And really, this has been one of the most game-changing
Mm.
developments, no, in the pandemic, not just in the Philippines, but really pandemic nga, so all over the world. And currently available shots are around 91%
Okay.
in preventing mga deaths.
Okay.
Pero sa Philippine vaccine drive, sabi ni Vaccines Czar Carlito Galvez Jr. na sa ngayon, yung vaccination activities, parang it has reached what he termed as an inflection point. So it's getting more and more difficult to find people to vaccinate who haven't received a
Right.
single shot. And we expect that to a certain extent because now it's a similar problem that other countries have had as well. That the
Mm.
higher you go up, you always end up reaching a certain point where finding being vaccinated will become more challenging. So um, the way that officials are trying to address this now is by bringing vaccines closer to people, whether it be sa mga workplaces nila,
Mm.
house-to-house vaccinations. Minsan may mga vaccination activities din na nakaset up sa mga transportation hubs. Tapos of course, yung mga pharmacies din. Um, And really, yung mga efforts na 'to ay, na-address yung biggest hurdle ng vaccinations right
Mm.
now in the Philippines, which is a lack of access to shots. A lack of access whether that be like logistics talaga or kung, hindi pa um super equitable yung distribution ng doses. Pero kailangan din i-highlight of course that like the reason why we're talking so much about vaccination now also is because really it's one way out, it's one major way out of the
Mm-mm.
pandemic. We can get everybody in the Philippines vaccinated, then it really lessens the risks of COVID-19 here in the country. Pero for us to be able to do that, kailangan na mataas yung vaccination level, not just among the entire population, pero kailangan
Mm-mm.
din mataas ito sa mga specific populations, specifically yung mga elderly at yung mga may comorbidities. Kasi sa ngayon, um, yung parang immunity wall na that we have from like uh, from vaccinations is still, it's still like half. So parang
Mm-mm.
vulnerable pa tayo sa COVID-19.
Right. Okay.
Um,
Sophia,
yeah.
may question lang ako kasi parang I've been seeing a lot of comments here na parang 2 years na pala. So yung sinasabi nila, 2 years na daw yung pandemic. And then, of course, you mentioned about the vaccination and vaccines are still the way out of this health
Mhm.
crisis. So, how would you assess the vaccination pace of our country compared to before? I mean, since we started, or compared to
Mhm.
other countries, like for example, our neighbors, paano siya?
Well, it could be much faster, no? Kasi
Okay.
we can say that just by even measuring against the government's own targets. Kasi kung naalala mo, gusto nila nung una ng 70% by the end of
Mm,
2021. Pero we only, sorry, 70% of the 70%. May mga ganong math sila. But we only really reached the 70% of the 70%, which is around 54 million Filipinos in early
okay.
2022. The same way that they want to reach the full 70%
Mm,
sometime this month. Uh, and
okay.
like I mentioned to you, we're well, hindi kasi masyadong up to date sa ngayon yung mga vaccine figures, pero we're roughly around 60% of the
Okay.
of total population fully vaccinated. So we haven't met the target that the government has set for itself. Tapos
Okay.
sa end of June, so by the end of the Duterte admin, they want to be able to vaccinate 90 million Filipinos, which is around 80 to 90% of the total population. So right now we're falling behind. It could be much faster because we're falling
Okay.
behind even by our own targets, no?
Okay.
Mhm.
Right, okay. So yeah, and then one last din na na-raise is parang sinabi ng Department of Health that hopefully by the end of the year, mare-remove na natin yung wearing ng face mask and magiging endemic. Is it possible? Kaya ba natin gawin, or kaya ba natin 'tong gawin, like in case?
Well, I think what one thing that makes me think about one thing that pops up in my head when you ask that question then is like or one way to answer that is precisely what we're doing right now, looking back, no?
Oo.
So bakit pa tayo nag-look back? Like I'm sure there are some people who would rather forget the last two
Oo,
years.
right.
Um, is it possible? I think it it can be. It's possible,
Mm,
but only if we really take stock, I think, of what's happened over the last 2 years. Um, ano ba yung mga effects ng COVID-19 that can linger even beyond the 2 years we have right now, even beyond the pandemic or whenever COVID is declared endemic. What are those lingering effects and who would be most affected? Because when we talk about exiting the pandemic, it needs to be it needs to be for everybody, right? Hindi
right.
hindi pwede na well, the world wants to move on and majority of Filipinos want to move on, so we're moving on. Kailangan din na um yung mga vulnerable populations like the elderly, those who are immunocompromised, at pati yung mga bata, 'di ba? Na
Mm,
hindi pa eligible for vaccines. That we still continue to protect them, and we can only really do that by taking stock of the last 2 years. Um,
right.
saan ba tayo nagkukulang? Ano yung mga kailangan natin gawin para ma-achieve yung endemic state na yon? And I think one thing that I've learned also is that the virus, there are so many things that we look at um or there's a lot of focus no on the virus itself no in talking about the future of COVID-19, mag-evolve ba to, or will it evolve into a deadlier form, will it stay or will it evolve into a less to a less severe form. But then the other half of the equation when we're talking about an endemic scenario is um may parang may mga to-do list or to-do
Mm.
list items pa rin yung government to make sure we end up in a state where we can say that we're endemic, and that's like what I mentioned, reaching in vaccinations, making sure yung mga access to treatments is wide enough, na may mga surveillance systems in place and everything. Yeah, there's that.
Ayan,
Pero
yes.
ako rin once may siguro may last question na lang
Okay.
din ako para
Sige.
sa'yo. I'm curious what you think are like the biggest takeaways from the year.
Mm.
Ano ba yung mga hard lessons learned that you think we shouldn't forget when we move forward and
Okay.
move on?
Okay. Yeah, siguro yung biggest takeaway ko from this is imagine 'di ba when lockdown was imposed, was declared in March 2020, parang inisip natin 2 weeks lang to, 1 week hanggang it dragged on na parang 'di ba parang naging ah parang ang sinasabi nga nila may season 2, season 3 hanggang umabot na nung parang we can keep track of how many seasons na naka-lockdown tayo. Parang yung biggest takeaway ko dito is parang of course wala namang prepared dito sa pandemic. I mean, 'di ba, wala namang may gusto na magkaroon ng pandemic na parang of course wala namang bansa na mas may nakakita sa atin na magkakaroon ng ganito so nakapag-better prepare sila. Pero I think big factor dito is yung yung government leadership when it comes to pandemic response. Kasi parang maraming times na parang feeling ko nag-trial and error tayo throughout the process, throughout the pandemic response. So parang marami kasing tao na namatay eh. I mean, yung mga namatay na yon is hindi lang siya numbers. I mean, itong mga namatay na to could be your family members, could be your friends na parang ang dami natin pinagdaanan na variants na parang hindi tayo natuto sa bawat response ng surge. So ayun, I mean, yung biggest takeaway ko dito is sana nagkaroon ng mas solid na response dito sa pandemic na backed by science. Kasi, di ba, parang ito yung naging critic kasi dito sa government response natin na parang marami talagang response na hindi masyadong pinag-isipan or wala. Like for example, yung wearing of face mask, though sinasabi nila, of course, na meron naman itong eye protection, pero marami pa rin kasing studies na lumalabas na sinasabi nila na wala naman talaga and
Oo,
sometimes it could, 'di ba, parang na mas
shield.
nagkakaroon pa tayo, mas mag-prone pa tayo dito. Ayun, yun yung mga takeaway ko dito, sana. And then, of course, like for example, gusto ko ding bigay yung takeaway ko when it comes to schools. Kasi parang sinabi din ng mga experts na parang hindi nag-work yung blanket policy when it comes to reopening of schools. Kasi kaya tayo napag-iwanan eh. Parang yung isang particular situation, in-apply nila sa lahat, isang solution, eh hindi naman iba yung extent nung uh, iba yung extent nung for example yung transmission sa Metro Manila compared to other cities or remote islands, like for example wala na nga silang access sa internet or wala malabo na nga yung internet connectivity doon, wala pa silang face to face classes. So ayun, and then of course katulad gusto ko na sagutin yung tinanong ko sa iyo kanina, bakit natin kailangan mag-look back. I think it is important to look back kasi it will guide us in choosing the right leaders this coming May 2022 elections. Kasi at the end of the day, yung bagong leader na to, yung bagong presidente na to, yung magmamana nitong pandemic response natin, 'di ba? So kung gusto natin na of course, hindi naman pwede nating iasa sa kanila totally, pero may factor doon kung yung mga platform nila is nandun talaga yung solid na pandemic response. So ayun, continue to follow us on Rappler for our coverage of the pandemic and for the coming May 2022 elections. Again, I'm Bons Magsambol and
I'm Sophia
Sophia to.
Cruz.
Yeah.
Thank you for joining us tonight.
Thank you for joining us.